Hello and welcome to this special show on Rajya Sabha Television. I am Vishal Dahiya and here we take a stock of India's fight against COVID-19. Now, there have been almost more than 100 days since the lockdown measures were put in place and more than 5 months since the first case of COVID-19 was reported in India. How have we fared in this battle against this particular pandemic? What have we done so far? How successful we have been? And also, how the entire situation is right now in terms of mortality rates or recovery rates, which are almost 60% of the entire figure as of now. We'll take a look at all these and other challenges as well, which face us from right now to the further journey onwards in our battle against this particular pandemic. And for this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Dr. V.K. Paul. He is a member with NITI Aayog, and he's also a member of the Empowered Group, which is looking after this particular entire pandemic as to how we go ahead and tackle this problem. Also with us is Dr. Gurtoo. He is Director, Professor and Head of the Department of Medicine in Lady Hardinge Medical College. And we're also joined by Ms. Ahuja. She is the Additional Secretary with the Ministry of Health and Family Welfare of the Government of India. Welcome all of you to Rajya Sabha TV studios. And let me begin with you, Dr. Paul. Let's begin with the first aspect of this entire problem, and that is let's look at the situation right now, starting from the day when we began with the first case and obviously lockdown measures were being put in place. From there onwards till now, how would you describe India's battle against COVID-19?
Well, India is facing this battle and facing this crisis with a great degree of scientific approach, graded response as the situation evolved, and putting together a mix of strategies that range from preventing the disease through COVID-safe behaviors on the part of the people, containment and surveillance strategy, preparedness to face the situation if the cases become sick and they need to be looked after in facilities, as also responding to the whole crisis in such a way that the lives and the livelihoods are disturbed to the minimum possible. So it has been a comprehensive response. In general, we have done well. If you look at the number of cases, particularly look at the deaths compared to several other countries, we should be quite satisfied with the way India has handled the situation as a nation. And of course, this is still an ongoing crisis. There are many more challenges to come. The disease is localized to a few states in particular, few cities and geographies but in particular, and these are the places which have high density of population. These are the places where the initial set of infected people came from abroad, because these are international travel hubs, but we are in control of the situation.
Okay. Let's bring in Ms. Ahuja here, the Additional Secretary from the Ministry of Health and Family Welfare, obviously the nodal ministry out there in terms of this particular pandemic outbreak. Ms. Ahuja, if you have to go ahead and analyze not only your ministry's response, but the overall response, as Dr. Paul is pointing out, has been a comprehensive one. But what has been the strategy which has been adopted from day one?
So let me first come back to your question, and I'm glad you asked me this because I was going to talk about it. What we have seen in the handling of this pandemic has been an all-of-government approach. You see it at the Government of India level, you see it at the state government level. Dr. Paul is in fact a member of the Empowered Group. But not only that, he's also involved with the ministry in so many other ways, and so are a lot of other experts who keep giving advice to the ministry. And he also mentioned about the data. You mentioned that also about the recoveries going up more than the active cases, and that is the kind of evidence-based decision making that has been happening at the ministry right from the very beginning. So I would say these are the two defining things, and apart from that, we have had a very proactive approach to dealing with it right from January, when the first signs of the pandemic came, even before the WHO declared it as a pandemic in fact. action had already started here. So it was proactive. It was also preemptive. The whole lockdown and how it has helped slow down the growth shows the proactive approach, and it has been graded. Now we are in lockdown 2.0, and it is a graded. It was a graded lockdown. It's a graded unlocking as well. So that has been the way, dealing with a dynamic situation that is constantly evolving, but based on evidence and based on inputs from all levels of expertise, I would say.
Okay. Okay, so it has been evolving graded approach with a particular strategy, obviously focusing on all aspects, working, the entire machinery working as a team there. Let's also, look at one more aspect before I go to Dr. Gurtoo from, taking his point of view from the front lines. Dr. Paul, in terms of this particular pandemic, what strikes out as very, very different is the very fact that there are no specific drugs, or rather there were no in the initial stages. Now, obviously, research work is coming up with some options and obviously no vaccine as well. So that made it really, really more difficult for, all the stakeholders, specifically the agencies, be it the government agencies or supporting groups as well, in assessing the situation, in coming to conclusions and, obviously framing a very acute definitive strategy as well.
Absolutely true, because this is a disease which did not exist before December 2019, practically. This is a virus which perhaps was not there, before that for more than a few weeks or days. This is a new disease, a new virus. We are still understanding its nuances. We are still understanding how it behaves, what devastation it causes in the body of the person that it infects with. And therefore, yes, there were uncertainties. But remember, the humanity has learned general principles of avoiding epidemics, and including those epidemics which track and spread from one to the other through respiratory processes, which is distinct from something like cholera, which is waterborne disease, or let's say mosquito-borne diseases. So those general principles are well known. First principle to remember is that you are susceptible. It's a new virus. There is no immunity in humanity at the start of the pandemic. So everybody is susceptible, and everybody therefore is susceptible to get the illness, has a predilection to get the illness and to get affected potentially and face the consequences. So this is a situation in which the response has to pan out. And then you use the fundamental approach of disease prevention, which means you make it difficult for the virus to infect you. And how do you do that? Well, there's no drug, so the shield of a drug is not there as a prophylactic drug, let's say. A vaccine is not there, so that shield is still far away. What do you do it? It is like fighting the war with bare hands, without any protective gear. What you do is you first and foremost create distance. It moves from one person to the other. You increase physical distance, and the predilection of the virus to travel from one to the other becomes difficult. And these principles were invoked in the very beginning of the pandemic response in February and March. It started with having those patients, those cases who came with disease. They were isolated, so they were not in touch. So we created distance of them from other people. So the physical distancing started to kick in as a new norm and a new way of protecting. And then, of course, you take the second approach, namely, you contain you surveil the population that is at risk, you surveil our geography that is at risk, and then you pick out ones that are positive, you isolate them. The ones that this person has come in contact with, the contacts are quarantined. And therefore, you create, again, difficult for the virus to move from them to other people. So you use that principle, and that's how the initial battle was fought and built on, and it still remains relevant.
Okay, definitely. It does still remain relevant. The very concept of containing the virus, isolating the affected people, and adapting to the new normal, which is obviously the term which is been talked about and being adhered to as well. Let's bring in Dr. Anil Gurtoo here as well. Dr. Gurtoo, from your point of view as a senior doctor who is battling this particular pandemic from the front lines, how would you describe the response so far and the progress so far as India's fight against COVID-19 is concerned?
So since now that we have traveled some distance, some almost 5 months now, let me break up the entire time sequence into 3 time segments for convenience and understanding. The first phase that we confronted as clinicians managing hospitals was sometimes February, early February. And in early February, we were confronted suddenly with this dilemma, at once a practical problem of how to accommodate thousands upon thousands of expected COVID patients that we were anticipating to come to us within capacities of tertiary care hospitals not meant for accommodating such huge patients and handling them all at once. That was a dilemma. That triggered a practical challenge. And to find a practical solution, we had to get together and survey every bit, every inch of hospital space available, reimagine and repurpose it from the perspective of getting patients there. Bed capacity expansion was the first issue. And we repurposed, reimagined every space, half-constructed buildings standing on the campus, partially functioning buildings, and we did it somehow within a period of 2 to 3 weeks. The next challenge was psychosocial, both in us, the doctors, the healthcare workers, and in the communities in which we went and came from. Initial February was marked by panic at all levels, because it was the uncertainty of what was to come, the lack of data and information of an entirely new situation, and that created a lot of uncertainty, and from that was born the panic. And that led to various reactions in us and in society towards our presence of stigmatization, of discrimination, of even depression and anxiety all around. That phase we got over when, as new data coalesced and congealed into new patterns, which were very reassuring. Then right now we face the challenge of processes, how to optimize the healthcare processes at the tertiary care level, and of them 3 are of prime concern. One, how do we, as a hospital, say Lady Hardinge, it has a community catchment area. So how to bring down the time interval between the first symptom in my patient and that person's entry into our healthcare system, our hospital, how to narrow that time interval. That is crucial now for us. The second crucial challenge is also a process challenge, and that is how to make sure that a person who comes to our hospital gets a functioning bed in the right time with the right amount of care on that bed. That is the second optimization process. And the third is providing more oxygen beds, because we are now very clear that more oxygen early given, better the outcomes. So these are the 3 processes challenges that we face right now. And we are beginning with we cannot have an ideal solution. So we are going in for optimization of whatever is available, while not letting the ideal be the enemy of the best we can do under the given circumstances.
Okay, definitely. This is a dynamic situation. So therein comes optimization of resources and improvisation as we go along as well. Ms. Ahuja, I'd like to bring you in here on a very important aspect, that is the coordination aspect. Now, all of us know that the state governments and the center did work together, and in such situations they have to. So in terms of being the nodal ministry, how easy or difficult was it for your ministry or for your team to go ahead from day one onwards and take all team members in terms of all stakeholders at various levels, state or city level, or at other tertiary ground level as well, be it policy guidelines or be it ramping up the health infrastructure, all these aspects which are the backbone in this fight against COVID-19?
I think the answer lies in the question you asked, Because when you use words like stakeholder and team, that means we work together with them. That we start on that premise that everybody is a stakeholder. And when I said in the beginning that it's an all of government approach, it means that it is a multi-sectoral approach. You cannot approach this evolving situation without the involvement of everybody. And I would say it's not just people in the government, it's also people in the private sector. If you see, when we started, we only had one lab in the country. Now we have more than 1,000. We didn't have the capacity for PPE manufacture. We didn't have indigenous manufacturing of H95. We didn't have our indigenous ventilators. Now we have all of that. So everybody has risen to the situation. What Dr. Gurtoo was also mentioning, everybody has risen to the situation in a very admirable manner. And especially I would mention the healthcare workers who have done and are continuing to do a tremendous job. I would also like to highlight that probably this pandemic has also made us realize the importance of surveillance, because it is not the first time that a pandemic has come, and it's not going to be the last time. So all across, I think people have realized the importance of surveillance. It has also taught us as citizens the importance of hygiene, the importance of maintaining the norms. What Professor Paul was saying in the beginning, that the virus doesn't know. Virus loves people who are unprotected so that it can attack them. So I think everybody has learned that. So when we say stakeholders, it's from the citizens to everybody who have been part of fighting this.
Okay, definitely. These are very important aspects. Specifically, there are very good positive takeaways as well, which we have from this battle against COVID-19. Dr. Paul, your views on this very particular aspect of, other stakeholders also putting in equal amount of effort or rising to the occasion, specifically the private sector, be it in terms of research and development on drugs, vaccines, or making of PPE kits, ventilators, masks, and other stuff which is required.
So in a way, it is not only whole of government response, as Ms. Aarti said, it is also whole of societal response to this pandemic. And certainly, as you have correctly pointed out, various sectors have risen. People at large have risen. Ultimately, I would first and foremost like to emphasize the fact that the way people of India have responded, it's remarkable, led by the Prime Minister himself. So not only did they create a situation of practicing physical distancing, we embraced masks as a way of life. We embraced cough etiquettes and hand hygiene and general hygiene as a way of life. We improved upon what we were doing earlier in this regard. We agreed and we started to be mindful of looking after our elderly. We understood the concept of comorbidities, because these two elements of age and comorbidities increase the risk of death. And I think vast sections of our society today know it. And also we are embracing Aayog Setu and so on. I'm very proud to say that the village communities, the way they have responded to the challenge of incoming migrant brothers and sisters, keeping them in a certain way in quarantine, looking after them, is a great example of people's participation and protected their own villages and protected the people. This has been, a situation where there are hardly any bad stories to tell. It has been a very, very, very well handled by the people of rural India. Very proud of that. At the same time, we are talking about other players. And specifically, I'm very proud the way the private health sector has come up in this hour of need. We really look upon this as public-private sector being just one sector for India. We don't distinguish anything. They have opened their doors. And when the need arises, the state governments have simply talked to them and engaged them. And their facilities and public sector facilities are one network of facilities. When Ms. Aarti gets a report, she gets a report of hospitals, COVID-specific hospitals or health centers. They are both together. We are one sector today, working closely with each other, depending on each other very effectively. So it has, another lesson of how closely one can work, and our industry has risen to the occasion. We are producing more than 5 lakh PPE sets every day, and it is rising by the day. When we started, there was not a single kit being made in India for testing. Today, there are at least 30 companies which make different kinds
Okay.
of kits, and we are on way for discovering a vaccine. That's another track. We have developed our own ventilators and so on and so forth. So the technical response has also been massive. Capacity response has been holistic, but people's response is of the paramount significance in this battle.
Okay, definitely. It has been a teamwork there. One more last question from you, Dr. Paul, and then I'll move on to Dr. Gurtoo as well. There on the future, near future aspects. What lies ahead in terms of challenges and what needs to be done?
Well, what lies ahead is the fact that the pandemic is still on. It is not gone away. We are still on the rising curve of new cases. And because there is a substantial spread today compared to pre-lockdown stage, so we are in that stage now. Therefore, we have to be very watchful. These numbers can be looked after so long as we keep the deaths low. The history will judge us as to how many deaths happened in this period. It won't be remembered how many cases happened. So the core is really what Dr. Gurtoo is referring to, how best to look after the cases who need hospitalization and whose lives are under threat. That is a very major focus for us to keep the mortality rate, which is currently at 3%, to be below 1% as we move along and learn. And we might have the advantage of learning to do better, mobilizing patients in time, but also perhaps very soon we will have a few drugs coming up in terms of helping us. But remember, all this is a consequence of a transmission of the virus. We must continue our efforts very effectively to make sure that the transmission is suppressed, and that is where we start with important emphasis on surveillance, containment, contact tracing, isolation, and quarantine comes up. Those efforts must be intensified. By the way, we have learned now in recent times that when we loosen up on that, when we dilute our efforts in that direction, we face the consequences. Two mega cities of our country are facing perhaps the consequences of, taking eyes away from that very, very important strategy to contain the disease. So let's be watchful. Let's remain together. Whole of societal response. Health sector will lead. Health sector will perform and deliver. But we need everybody on board to tackle this.
Okay, so it is a twofold challenge: contain the virus and bring down the mortality rate as well. Ms. Ahuja, your views on these challenges which are there, and how do we tackle them?
So, like Dr. Paul was saying, what do we have in front of us today? Today, we see that the transmission is moving from concentrated urban pockets and it is getting dispersed to newer geographies. We need to be mindful of that and we need to be proactive. And it is here that the citizens' response comes into greater play. Because now, what is it that we need to do to contain the spread? For all of us, wearing masks, practicing isolation from each other. Now with the unlock happening, we see that we should make sure that the markets are not crowded. We should make sure that we don't have large functions like marriages and all with a whole lot of people come. So that is the way that we can defeat the spread of the virus into newer areas and into newer people. So the citizen involvement is going to be crucial. And I also have now we are moving into from larger lockdown areas to smaller containment zones. So there again the emphasis is not just of government but also of citizens cooperating so that the effectiveness of the sanctity of the perimeter of the containment zone is maintained. So these factors, these behavioral issues are going to be very crucial in the days to come in the control of the pandemic.
Okay. We're running short of time, but let's have a quick concluding comments from Dr. Gurtoo as well in terms of what lies ahead. Dr. Gurtoo, would you like to add something to what Dr. Paul and Ms. Aarti is saying?
I would just sum up what Dr. Paul and Dr. Aarti has just said, and I would sum up as a clinician who handles basically patients. Our concerns, to sum up the two, are twofold. One, we fear the return of the habit, old habits, social segregation, crowding, as the lockdown begins to unlock. One, return of the old habit, and two, return of the virus in a second wave or another wave. The two are correlated, and therefore, I would like to factor in these two as the future strategies. How shall we live? Because we are social animals, being humans. How shall I live in a way that is socially meaningful to me today, at the same time avoiding getting infected or giving infection to others? How shall I live? That is the crucial psychosocial question that we all confront as we begin to step out. And the two returns that we fear are the return of the habits, the old habits die hard, as they say, and the return of the virus. So we need two levels of surveillance: the health surveillance systems to activate us and inform us, and the second is the behavior surveillance. Some enforcement and public messaging ought to be done on that level also.
Okay, thank you so much, Dr. Gurtoo, Dr. V.K. Paul, and Ms. Aarti Ahuja as well for sharing your views on this very important aspect of as to how we have fared so far in our battle against COVID-19 and what lies ahead. And as our panelists pointed out, clearly we have done a very good job so far in this battle against COVID-19, but this fight is far from over. And as our guest pointed out, there are several aspects which will have to be looked into. But from a citizen's point of view, what is really important is to ensure that we contain the spread of this particular virus, and that can simply be done by adhering to the norms and guidelines. One, with respect to social distancing, and two, please do not forget to wear a face mask when you step out of your houses. Thank you so much for watching Rajya Sabha Television. We'll come back again tomorrow with a different topic.